Welcome back. Zambia's government yesterday announced it was postponing the start of the new school year by 3 weeks due to a cholera outbreak that has claimed 150 lives since October. According to the Education Minister, Douglas Syakalima, schools that were due to reopen on Monday, January 8, are now scheduled to start classes on the 29th of January due to rising cholera cases in most parts of the country.
More than 4,000 cholera cases and 150 deaths have been recorded in the southern African country, according to the latest government figures, indicating a mortality rate of 3.7%, while 342 new cases of the bacterial disease have also been detected in the last 24 hours, with 23 deaths reported. The government says it is concerned about the negative impact pandemics have had on the education sector, adding that safeguarding the lives of school communities remains a priority.
Zambia had in December stepped up a campaign to halt the spread of cholera, including the distribution of chlorine to disinfect contaminated water. We're joined this morning by Ambassador Emmanuel Mwamba. He's Zambia's former ambassador to Ethiopia and the permanent representative to the African Union and member of the Central Committee of the Opposition Patriotic Front. Good morning, Mr. Mwamba. Thank you very much for joining us.
Thank you. Good morning, and good morning to your audience. Happy New Year.
Happy New Year, too. Hasn't seemed like a very happy New Year with the updates regarding cholera. Give us a picture. We know that this is not the first time that Zambia is experiencing something like this. So give us a picture of what the numbers are saying and what the true position of the cholera situation is in Zambia.
We have expressed cholera outbreak. The outbreak has been in the country since October 2023. And as you have stated, so far, as at yesterday, we've lost 150 lives. We have not seen a consented public campaign awareness program. We have not seen measures such as restricting movements and sometimes maybe banning of sale of meats, in open spaces. We have not seen any of those measures, and we express concern. Now we are sitting where we have lost 150 lives, and cholera last broke in Zambia in 2018. For Lusaka, Lusaka is the epicenter of this outbreak, I think due to the number of townships that suffer from lack of proper water and sanitation and drainage facilities. We are in the middle of the rain season, and as members of the opposition, we're calling on government to conduct cleaning exercise, declog all water drainages, and provide clean water to our people. So it's a sad situation, but we saw our leaders, they were on Christmas holidays, they were on New Year's holidays. Most of them haven't even come back, including the head of state, who was at his cattle ranch in southern part of our country.
Ambassador Mwamba, let's understand exactly what the reality is in Zambia with regards clean water and maybe also open defecation. Has the Akanje Cholera government in the last couple of years done anything to improve on the level of clean water that's available to the average citizen in Zambia?
Under the first of all, clean townships, put tarmac roads, install drainage facilities, and there were a lot of water projects to ensure that people had water reticulation and at tapped water. I think that project hasn't been followed up aggressively, especially in high density areas of our townships. We have been appealing to government. At the moment, we have over 5 outbreaks. We have dysentery, this is a waterborne disease. We have typhoid, this is again a waterborne disease. Now we have cholera outbreak. And we have demanded that government must pay attention, especially to the issues of water and sanitation. On diseases, because most of our townships now have water up to their taps, up to their homes. And it is, like they say, cholera is a poor man's disease. And it's just neglect, I think, of both institutions. Like we are saying, the outbreak was announced in October. And there hasn't been concerted public awareness about the dangers of cholera. Because when you have an outbreak like this, in some cases you even restrict movements of both people and fresh foods.
Okay. All right, let's talk about, I mean, I did hear you saying a number of, I just want to clarify, you are inferring that the leaders in Zambia haven't paid particular attention, because I did hear you saying a number of them were on Christmas holiday. Just to clarify, they haven't paid as much attention to the situation in Zambia. Is that correct?
So we saw the Minister of Health finally visit cholera centers yesterday. We have seen now public awareness broadcast being now distributed on national television, but this is too late. This is, for example, in one day, the other day we lost 23 people. The other day we lost 16. So in a period of 2 days, we lost over 39 lives. We have seen government come on board very late. They've opened one of our national stadiums as a cholera center because our health centers and health facilities are totally overwhelmed. We have recorded one health worker who was tending to patients who has since succumbed to the infection that he got, a male nurse from here in Lusaka. Our appeal has been that, for example, our party offered to clean on New Year's Day, to clean Lusaka and Lusaka CBD. We said the outbreak is serious. It had claimed about 52 lives at that day, and we offered to clean, and they brought in politics. They couldn't allow us to clean the garbage in the Lusaka business district. We think that government hasn't paid serious attention to this crisis. And cholera outbreak, typhoid, or dysentery diseases are very easy to manage if you resolve the issues of water and sanitation.
I mean, it's obvious that Zambia certainly has a sanitation problem. The numbers are quite alarming. To see the number of people who are dying in 24 hours, obviously the health centers are overwhelmed as expected. Now let's talk about the possibility of getting cholera vaccines. I did read up about Zambia being in talks with the World Health Organization regarding getting cholera vaccines. Do we have an update on that?
We think that the issues of vaccines, like it was with COVID-19, it brings in a fresh debate. You don't want your population to appear like they are guinea pigs because of a crisis. Yes, a cholera vaccine could be ideal, but the underlying factor is the issues of water and sanitation. Resolve your sewerage pipelines, resolve your issues of clean health. The issues of vaccine may mask a bigger problem. We think that we should go to the root cause of waterborne outbreaks, and that is to provide clean water, provide safe water, collect garbage, do not allow garbage to pile up, allow safe environment, especially for our marketeers who are selling meats, fruits and vegetables. Put measures. The measures, for example, they put in to suspend the opening of early childhood, primary and secondary schools. This is a good measure, and it needs to be recommended. But those are the measures. For issues of vaccines, I know it brings a new dimension of debate that people need to have consensus over these vaccines. There are a lot of concerns around these new vaccines, and people just should not be subjected to vaccines without national consensus, especially among stakeholders.
Yeah. Of course, number of people affected, of course, more than 4,000. And we, of course, still have fears that more people will succumb to this very, very, well, I'm not sure how to describe it, but the death toll will increase And these are fears, these are concerns. So tell us, a little about, about the fear that you have about the numbers crossing 150 and beyond, and also schools being delayed for 3 weeks now. Do you expect that they maybe would need to be pushed even further until the government has a hold on this cholera outbreak?
In high-density areas, this is where we have the biggest problem. In high-density areas, some do not have running water, they do not have flushable toilets, they use pit latrines, and pit latrines usually are next to water wells. The Lusaka City Council must carry out a very, very aggressive program. First, to bury those pit latrines, to ensure that you don't have pit latrines that are next to those shallow wells, and this is where the most of the infections are occurring. We've seen that they've put up water tanks, mobile water tanks, so that people are not collecting water from these shallow water wells, which are a critical source of infection, especially that we are in rain season, and there is cross paths between toilets and then those shallow water wells. It requires a huge public campaign for all of us stakeholders. That is why even as the opposition have been putting pressure on government so that we can save lives. And we've seen the outbreak just escalate in a short period of about 10 days from 1,000 people infected to 4,000. And we are expecting more rains up to end of February. Unless we enforce these serious public measures, we may have to lose more lives, unfortunately.
I mean, it's quite scary to hear that, of course, we're expecting more rain. We know the role that this played. This is not the first time that Zambia has experienced flooding. Flooding was announced on the 6th of October 2017, and over 5,000 cases were recorded, about 114 lives were lost. And even after that had been controlled, by the next year, mid-March, we did see that there was a flooding, and this flooding sort of reactivated it. And now you mentioned that there are going to be rains. Are there fears that flooding, is a factor? And when you say that, I mean, for us to have had this happen before and have it happen again, if we get a hold of this, chances are, unfortunately, that it can still happen again. So who are we to hold responsible? When the people of Zambia are asking questions, when they're saying that information wasn't passed out early enough, who are the people to be held responsible?
So first of all, there are ongoing public projects, public works in resolving drainage issues, because that's one of the biggest issues is drainage. We had one of the biggest projects, it cost about $300 million, and it was done together with the USAID, the Millennium Challenge account. This project is complete, but we need more of such projects to set up, I think, drainage facility in Lusaka. And Lusaka sits on, on a rock. So it's easier for it to flood. The water doesn't drain quickly. So we need to invest in more drainage facilities. And now there's a project to bring sewerage facilities in townships where they are using pit latrines. And we hope that process should be made far cheaper. The service contribution should be cheaper so that our people can access the sewerage facilities that are being provided under this new program. So the solution, long-term solution, is investment in public infrastructure. Water and sanitation, we are one of the biggest water projects. Our water for Lusaka, which has a population of about 3 million to 3.5, gets its water from a river called Kafue, which is in another town called Kafue. And so there's been also that project to bring clean water into Lusaka, but the distribution network is old, it's aged, it leaks, and it's also part of infections. So we need to resolve that water and sanitation, the water reticulation program, and in places like townships where we do not have a sewerage facility and piped water, that is a critical investment that requires to be done. Who's to blame? I'm still blaming government. We had this outbreak in October. This was before the rains. And with this climate change, we always have rain beginning of October. But almost all the country didn't have rain until around December. So you can see that nature helped us. Government officials went to bed, yet the cholera outbreak was looming and lurking, and numbers were being recorded every day, although there were low numbers. But this was because the water, the rains that didn't come. And as soon as we had deluge of rains after Christmas, and the outbreak now showed its full extent, where we have lost 150 lives.
If we had a different government in office, what immediate steps would you have expected, would be taken?
You can't have, with the crisis that we are facing, we have an economic crisis, we have a huge social crisis. The high cost of living that is being experienced across Africa has not spared Zambia. Zambia is experiencing the worst form of high cost of living. I think the worst in the last 30 years. Prices of staple foods, fuel are really hurting. In fact, there have been reports from both the IMF and the Economic Intelligence Unit that is even fearing that because of the current issues the country is going through for high cost of living, then the legacy issues of poverty, unemployment, especially youth unemployment and just underdevelopment, may bring civil strife. With such reports, you expect a leadership that quickly responds like you have a crisis. You cannot have a leadership where its ministers are showing pictures that they're in South Africa, in Cape Town, they're in Dubai, or they're at their farms in their rural homesteads, while you have a national crisis, as I have described. So you have seen a laissez-faire attitude where they are not responding to the various crises that we have: economic, social, health. For the first time, we have diseases that we thought were in remission or never occurred in our country, like syphilis. Syphilis, the sexual transmitted disease, is also, there's some outbreaks in some towns. So we are saying the country is facing challenges, monumental challenges it hasn't faced in the last 60 years of its life. You expect a leadership that will respond with a sense of agency, with a sense of responsibilities, not a laissez-faire attitude, and not taking glory that I was elected with massive numbers. I'm a popular leader, and therefore I can go to sleep. And this is what has happened. You have a very popular leader who then has abandoned ship and taking glory in the electoral victory of 2021, while the country is literally burning. So the crises that our country is facing, whether it's in the agricultural sector, energy sector, the high cost of living, now we have these epidemics and outbreaks that were not known to our country. Like I stated, for cholera, the last outbreak was in 2018. There were measures put in place that every cycle of our rain season didn't turn out into a cholera outbreak. And so what has happened in the last 2 years, that these measures are broken down. The previous government had a campaign that every Friday there was a mass cleaning exercise. And every last day of the month, there was a massive public cleaning exercise where everyone participated, from business, shop owners, workers, and then members of the public were invited. It was dubbed Clean Zambia campaign. That campaign has been abandoned since 2021. We do not see those Friday cleaning exercises of our CBDs and our townships. We don't see the month-end cleaning that would occur every month end. So some measures are good. Even when you are a new government, it is important that you adopt good programs. Don't abandon everything that was done by the previous government because of politics. The cleaning exercises, for example, countrywide, or Keep Zambia Clean, was a wonderful program that this government must revive.
Well, we certainly have seen the numbers. The numbers are scary, and we hope that the government is paying attention and that this doesn't become a repeat incident, that we can, first of all, get a grip on what is going on right now to prevent further loss of lives and ensure that it doesn't happen again. because it would be a shame to allow this happen again, especially when there are measures that you've mentioned, for example, that can be put in place to forestall this. Thank you so, or rather to prevent this. Thank you so much, Ambassador Emmanuel Wamba. We wish Zambia all the best. We're standing with Zambia at this time and hoping for better news from that region.
Thank you very much, and God bless you. God bless Zambia. God bless Africa.